I think this will both be entertaining and informative. So on with us now is Dr. Unger on Instagram at Dr. Jacob Unger of Maxwell Aesthetics. Dr. Unger, how are you?
I'm doing great.
Glad to have you. Let me just read a few credentials about Dr. Unger here. He is a board-certified plastic surgeon. He works at St. Thomas Midtown Hospital and owns Maxwell Aesthetics in town, where he does Botox, breast implants, and other plastic surgeries. He specializes in face, breast, body, and skin treatments. How we know him is Bay, Ray's wife. She fought and beat breast cancer, and he did her procedure afterward. And since they had a relationship, now Ray went in and got Botox. And that's where, so just so everybody knows where we are in this. Hey, Dr. Unger, how many guys come in for Botox?
I would say more and more. It's probably about 10 to 20%.
Wow, that much. And how much does Botox cost if I go in, and get the needle in the head, and then I also, like, how long do I have to wait to have to get another shot as well?
Well, someone with your level of stress and anxiety, probably more than others. But, our team's really good and just uses what you need. So it's on a per unit basis, and different faces need different amounts. It's about $13 per unit, and you need anywhere from 10 to 50 units, I'd say.
Okay, so you're talking about a few $100 if you come in for Botox.
Yeah, probably.
Is that what you do the most of daily?
Me personally, no. So I have nurse practitioners in the office that help with a lot of that. I spend most of my time doing surgery.
With us right now is Dr. Unger. He's a plastic surgeon at Maxwell Aesthetics, world-renowned guy here, which leads me to some questions. I was thinking about this over the weekend.
Okay.
How often do people come in with a picture of somebody famous or a cousin and go, Dr. Unger, make me look like this person?
Not as much as maybe happened in like the 90s and 2000s when there were all those TV shows on, like The Swan and all these celebrity shows. People are more educated, and what I really try to do is enhance people's kind of natural features and just make things harmonious and look appropriate and non-operated. So some famous person's nose on your face is going to look weird, right? So you just want to do things that look appropriate and elegant, and it's much more of a nuanced conversation than make me look like a famous person.
On with us now, Dr. Unger, world-renowned plastic surgeon. Since you're a doctor, do you watch doctor TV shows at all? And then what is misrepresented about what you do the most?
I mean, of course I do. How do you think I learned everything? No, I don't watch much TV at all these days. I don't find much time for it. But the majority of doctor shows are just kind of way over-dramatized. I actually think the best show of all time, doctor-wise, was probably Scrubs. That was a fairly accurate representation of, like, residency life.
So what would you say the biggest misconception is about what you do as a plastic surgeon? Because I think you just go in and all right, everybody wants bigger boobs, line up, we're about to make them. Like, that's what I think of.
That's the public common perception. And so plastic surgery is a lot of things. It's kind of, we consider ourselves the surgeon's surgeon. So we solve really complex surgical problems, soft tissue problems like post-traumatic injuries, a lot of cancer reconstruction. A large part of my practice is breast cancer reconstruction. So kind of rebuilding people and allowing them to regain normal function and form, and then enhancing and improving form and function. So it's not just making boobs bigger. It's a lot of cancer and traumatic reconstruction too.
On the phone now, Dr. Unger, world-renowned plastic surgeon, and that's how we know you, because you worked with Ray's wife, Bay. In her cancer journey, she fought it, she beat it, and then she went to you to get her breast reconstructed. When do you get into that process with her?
We do that in the very first step. So I work with the oncologic or the cancer surgeon. At the same time that the breast tissue or the entire breast is removed, I get to work on reconstructing the breast. So patients go to sleep with cancer, they wake up, God willing, without cancer, and with the beginnings of their reconstruction.
So you're there from the beginning. Are you almost like someone they have to lean on to for support?
My goal in most cases is to create a shape and give women back their sense of confidence and maybe even improve things beyond what they came in with. So it's a very long journey. That's what I love about breast cancer reconstruction. I mean, Bay is an amazing patient, an amazing person, and most of our patients are just incredible people, and you get to really connect to them and be an important part of their life and their cancer journey, and it's long term. I mean, Bay can never get rid of me. I have to see her every year or forever because I'll always check on her and make sure everything's going well and looking right. And I'm kind of there with her for forever.
I got like over my belt line, I got just a little pooch now. How much pooch do I need to do pooch removal?
It all depends on your personal pooch preferences. So,
my preference is no pooch, Dr. Unger.
Well, then we can get rid of it, man. Come on in. Let's go. I'll see you tomorrow morning.
What would happen if I said, hey, I'm like 5 to 7 pounds more than I want to be. I'm getting married in July, and I come and I show you, and I'm like, I take my fingers and I kind of show you that pooch. What do I have to do then? What do we do? How long am I out? How good am I going to look? Talk me through it.
Well, you're going to look amazing. I have a bunch of different options depending on what's going on. So it could just be a little suctioning of fat, which if it was really a little pooch would probably be 1 hour. That's 2 years of working out gone in an hour. And if there's a lot of pooch and a lot of skin, then you do something like a tummy tuck where you cut out the skin and the fat directly and sew it back up. That's more like 2 hours or so.
Yeah. Let me stop you for a second. Wait a minute. I've been busting my butt on this Peloton, on this treadmill, boxing in gyms. And I got this little pooch that I can't get rid of. It will not get. And you can make that go away and out. How long am I like on the DL though, where I can't do anything?
Truthfully, I have patients who are in the public arena who have a little bit of suction here or there. They go back to work or back on a screen with clothes on in like 3 days.
Let's go.
Okay, hold on. I'm just asking. These are hypothetical questions. How much would that cost?
Hypothetically?
Like for real, hypothetical. Like just some guy comes in off the streets, about 6'1", kind of nerdy guy.
Wears glasses.
Got a little pooch. Yeah. How much would that cost? Not me though, but how much would that cost?
I actually don't pay attention to that part of the business. My job is to take care of patients. I mean, it costs money. Obviously, it's surgery, and there's a whole team, and there's anesthesia.
$3,000?
I don't know. More than that, yeah.
More than $5,000.
Yes, probably more than that, but not that much.
I'm just working out.
It depends.
Oh, okay. All right. I was about to decommit completely. I mean, hypothetically.
Hey, for your friend.
My buddy Robbie Jones.
Yeah.
Let me ask you a question, Dr. Unger. Right now, Dr. Unger is on with us, owns Maxwell Aesthetics. He worked with Bay on her breast reconstruction after she had cancer. He worked with Ray. Ray got Botox. I don't know why Ray got Botox. Ray got Botox. But why are you called a plastic surgeon?
Oh, that's a great question, Bobby. It actually comes from the Greek word plastikos, which means to mold. So we create shapes, whether it's tummies or breasts or faces. And so we work throughout the entire body to rebuild form and function.
I'm going to use that someday.
Yeah.
I would say at a party, but I don't go to parties, even out of COVID.
Someday
I'm going to pull that out of my butt and be like, yeah, duh, plasticos.
If you ever are at a party, now you have a great factoid.
Eddie, you have a question for Dr. Unger?
I do. So back to the whole Botox thing. Ray calls it Brotox. Is that something just dumb Ray is doing, or Dr. Unger, is this something you're behind too? Are you calling it Brotox as well?
It's a thing. It's not just a Raymundo thing. It's Botox for the bros. We want men to feel empowered too.
Okay. Yeah, but did you call it Brotox when he came in, or did he name it that when he came on the show because he read it on the internet?
I'm going to take the fifth.
Okay, he read it on the internet, yes.
That's what that means right there.
Lunchbox, do you have a question for Dr. Unger?
Is it embarrassing for guys to get Botox? Do a lot of guys wear sunglasses and hats when they come in because they don't want people to know?
No, man, it shouldn't be. It's just a natural progression of taking care of yourself and exercising and wanting to look good. I mean, there's no shame in that game.
Agree with that. I heard that. Dr. Unger, we appreciate what you do. On the serious tip, it's that you do work with a lot of cancer patients. I mean, that's what I know you from. And we have questions because we're kind of dum-dums about plastic surgery in general. I have to also relay your message to Robbie Jones, my friend. But other than that, we appreciate, what you do, because you do help a lot of people get their life back in a very serious way. So we appreciate you coming on the show, and you can follow Dr. Unger at Dr. Jacob Unger on Instagram. What do your friends call you, Dr. Unger?
Jacob.
Hey, do your friends get a discount, Jacob?
Sure they do, Bobby. Come on.
See me? I called him Jacob, see?
Do friends of friends?
Yeah.
Yeah.
It's a thing. It's just an office thing.
Nice. I like your office then. All right, there he is. Hey, Raymundo, do you have a question before we go from Dr. Unger? I know you know him already, but I don't know if you're sitting over there on something.
Yeah, I just have something cool to say. I think he's great because I really didn't. This is going to sound uninformed, but I didn't know that women were able to keep their breasts after cancer, and that what his ability to do what he does. We've even known other women that have gone to him after they got their reconstruction because he then made them perfect. So I just want to say props, dude. You give women confidence all over Nashville, dude.
Thanks, man. I appreciate you guys, and thanks for having me on. It's been awesome, and I really appreciate it.
All right, there he is.
Yeah.
I think we should clap him
Yeah,
out.
that
That's
was
a good
great.
interview. Dr. Unger. All right. Love to see that.